The broadcast is now starting. All attendees are in listen-only mode.
Welcome. My name is Lee Lowry, and I'm the Executive Director for the American School Health Association. Thank you for joining us today for our presentation, Results-Oriented Evaluation. Before we get started, I'd like to share a little bit about the American School Health Association. Otherwise known as ASHA, we are the only organization that addresses multiple disciplines in school health and that is devoted solely to school health. Our membership of approximately 800 individuals represents school health as administrators at the local, state, and national levels, as health and education professionals in a pre-K through 12 school setting, and as academics who conduct research that informs school health professionals. We're also the proud publishers of the Journal of School Health, a premier journal in the area of school and adolescent health. Members of ASHA can elect to receive a hard copy or electronic copy of the journal. Our membership fee is inexpensive and provides you access to the journal and also to our biweekly e-newsletter, School Health Action, as well as free continuing education hours through webinars such as today's presentation, through CE qualifying JOSH articles. If you haven't already, please consider joining, volunteering, and becoming a member of the ASHA community. Visit us at ashaweb.org to learn more. As I mentioned, the continuing education credit for today's webinar is free for all members. If you are a non-member and you would like to receive CE credit for this webinar, we require a payment of $30. After the webinar, you can receive one Category 1 CE/CH for MCHES and CHES, one CNE contact hour for nurses, one CPEU for registered dietitians and nutritionists, or a certificate of attendance based on 70% or more participation today. Certificate of attendance is applicable to the prevention specialist domains listed on the screen. Participation is measured by the amount of time the webinar remains active on your screen. We'll provide details for obtaining CE in a post-webinar email that will go out this week. A couple of notes before we begin. Your phones will remain muted for the 60-minute duration of today's webinar. If you have a question for our presenter, please type them into the questions box on your screen. We'll answer your questions today as time allows. All unanswered questions will be responded to and provided in a post-webinar email that you will receive this week. We'll also include the evaluation survey, instructions for submitting for CE, and a link to the recording of the presentation. I'd like to go ahead and start off with a pre-assessment, which we'll follow up with at the end of the webinar as well with the post-assessment. So we're going to launch our first poll. So we're asking you, before we begin the presentation, to please rate your comfort with program evaluation. Are you ready and raring to go? Solid? More tips and pointers would be great. You need more application and field experience? Or is your response, whoa, Nelly? Okay, so we've got some votes coming in. Looks like we have 83% of the vote in, so we'll see what results we have here. Can you see that, Jeanie? Can you see the results on the screen?
All I can see is myself.
Okay, here we go.
There we go.
I think maybe I can see them. We can see them now?
Yep.
Okay, great. All right, so we have 17% who are ready and raring to go. We have 39% who are solid, just some more tips and pointers. 38% need more application and field experience, and only 7% are at whoa, Nelly, so that's good. All right, so now we're going to go ahead and get started with our session. We're delighted to have Dr. Jeanie Alter here with us today, presenting results-oriented evaluation. Dr. Alter is an evaluator with the Indiana Prevention Resource Center, which is a part of the Indiana University School of Public Health, Bloomington. Her primary projects involve evaluation of community-based substance abuse prevention efforts. Over the past 15 years, she's evaluated after-school drug prevention programs, community-based tobacco control efforts, and environmental strategies. She is a certified prevention specialist and Master Certified Health Education Specialist. She's a member of the ASHA Board of Directors and chair of our Professional Development Committee. Welcome, Dr. Jeanie Alter. I'm going to turn it over to you now.
Great, thank you. As Lee mentioned, I work with the Indiana Prevention Resource Center, and so what we do is we help provide communities, and that may involve schools, but it also might be grassroots community coalitions who have been given grants to do substance abuse prevention initiatives in their communities. So we evaluate those efforts for them, but we do it from a participatory approach where we're really trying to get them not to be, little evaluators by the end, but to get them to be better consumers of evaluation information, to get them to feel more comfortable with evaluation. Too many times I have seen people's eyes glaze over when the word evaluation comes up, and it's sort of a terrifying phrase or undertaking. And oftentimes it's seen as just, okay, this is something I have to do, my funder is requiring it, and I may not enjoy it, I may not truly understand it, but it's something that I need to do to kind of get through that hurdle. So my hope is that that I'll be able to kind of demystify it a little bit for some of you who aren't quite as comfortable with it. Maybe for those of you who on the poll indicated that you're ready and raring to go, maybe I'll have we'll have a light bulb moment about something. I always like to hear things over and over again, so hopefully that'll be the case for you. So if you'll go to the objectives slide, please. So once we're finished today, if I've done my job well, I hope that you'll be able to describe the benefits of evaluation, list the different components of a results-oriented evaluation, and we'll talk about the difference between implementation-oriented evaluation versus results-oriented, develop an outcome target, and also identify appropriate outcome indicators. Next slide, please. So program evaluation is defined as the systematic collection of information about the activities, characteristics, and outcomes of programs to make judgments about the program, improve program effectiveness, and/or inform decisions about future program development. So that all sounds kind of complex and technical, but in fact, evaluations can be very simple and can oftentimes utilize information that you've already collected in kind of determining the worth of the program. And that sounds sort of harsh, but I want to remind you that most evaluations aren't conducted to determine whether a program should be discontinued and staff let go and all of that, but rather it's really done to determine how we can improve on our efforts. So next slide, please. So as we saw from the definition, we evaluate for a variety of reasons. One is to determine whether our program is producing the desired outcomes. So once we get to toward the latter part of our webinar today, when we look at a logic model, when we go into a program, we have ideas about what we expect to see at the end. That's why we select the strategies that we do. So we want to make sure that we can show that our program is producing those outcomes that we expected and that we desired. We also want to find opportunities for continuous quality improvement. When you implement programs or strategies in the real world, they never happen the way you would expect or intend. So there are hiccups and bumps along the way. And what a program evaluation allows us to do is to find those areas where we can improve. And we can't identify those areas without kind of keeping track of what it is that we did along the way. And we'll talk a little bit more about that as well. It also helps us ensure that effective programs are maintained and also that resources aren't wasted on ineffective programs. So we've seen this in a lot of different areas, and for example, from my area of expertise when it comes to substance abuse prevention, one of the common examples of a program that did not perform in the way that it was intended was the DARE program. It did not lower the likelihood of students engaging in substance abuse or substance use. In fact, it kind of did the opposite. And so program evaluation helped identify that. It also, if we go back to the previous bullet, it helped them find opportunities for improving the program. So in that example, we hit both of those. It also helps, and maybe this is kind of the thing that brings a lot of people in, is that it justifies the need for further funding and support. So our funders require us to do program evaluation because they want us to justify to them why we're providing funding, why they are providing funding to us. So it's a very important reason. But we also, the second part of that is to justify the need for support. And that support can be some of the inputs that we'll talk about later, volunteer time, in-kind contributions, whether that be snacks or meals or space or all those kinds of things that we really rely on our community around us and our schools to help us implement a program. I don't know if any of you on this webinar have unlimited funds to carry out your initiatives. I'm guessing not. So we really require and need our community partners and our school partners to really get behind and support what we're doing. And sometimes we need to provide them with evaluation information to do that. Next slide, please. Excuse me. So, I'll interrupt myself just to say, in some of the examples I give, I'm going to fall back on my area of expertise, and that is substance abuse prevention, and I may even wander into treatment just a tad. So just know that those are examples that are comfortable for me and that are translatable to whatever area you're focusing on as well. So when we look at the difference between implementation and results-oriented evaluation, this may be language that is not familiar with you, familiar to you. You might be more comfortable with process evaluation and outcome evaluation. But basically, process evaluation or implementation evaluation really just documents how a program has been implemented and how these results were achieved. So we really want to understand or fully understand how a program works and how does it produce the results that it does. These kinds of evaluations are useful if programs are long-standing and have changed over the years, or if you're finding that employees or clients or students are reporting complaints about the program. Sometimes it helps to go back and really look into what it is that we're providing. To get some clarity about those. So this type of evaluation is implementation focused and concerned with the question of, did they do it, right? Did they mobilize the needed inputs? Did they undertake and complete the agreed upon activities? Did they deliver the intended outputs or the products or services that they were expected to produce? So what we want to do in an implementation evaluation is answer the questions, what did they provide? To whom did they provide it? On how many occasions? Under what circumstances? And the kind of information that we would collect would be, the number of people who received services, the number of activities, or the number of meetings, the amount of money that is spent. So those are the kinds of things that we're concerned with related to implementation evaluation. And the next slide, please. Uh-oh, my slide's a little wonky, but results-oriented evaluation, those really focus on the outcomes of the services delivered to your clients or your students, or their participation in a program. It wants to know, did it change people's attitudes or beliefs? Did it change risk or protective factors? Did it change trends in morbidity and mortality? It's really focused on the impacts, the changes, the benefits that you see as a result of the services that you've provided or the program that you've offered. Next slide, please. So some of the components, we'll go through some of the components of a results-oriented evaluation, and then we'll put it all together into a logic model. So the first component to talk about are the inputs. And this is really, this kind of gets at the planning portion of program planning. It's redundant, but really it's looking at what are the materials and resources that are used to serve clients. This could be equipment, this could be staff, volunteers, space, cash, in-kind donations like food, all of those things that you're going to need to pull together in order to deliver the services that you want. Outputs are kind of the unit of service for a program. So how many people do you intend to serve? What are the number of sessions or activities that you plan to offer? Understanding, and setting some goals for yourself in terms of those kinds of outputs are really helpful. And it's something that we have to do with our communities as we work with them in their evaluations. Next slide. Okay, thank you. So activities, that's pretty straightforward in terms of what services are we offering to our clients or to our students. Are we going to be engaging them in skill building, for example, refusal and resistance skills when it comes to substance abuse prevention? Are we trying to get them to have better communication skills? Those are those kinds of skill building activities are really important and prominent in health promotion. Are we just going to be disseminating information? Also a really important part of the work that we do. The next two, transportation and meals, those are things that we might consider inputs, and I put those down as activities because I wanted to draw attention to that sometimes the things that we offer may feel very supportive in nature and maybe feel more like an input, but in fact it's our contribution is just a supportive contribution. And the example that I'll give, and this is more of a community-based example, but you may have examples in your own work. There was a national program called Access to Recovery, and the purpose of this program was to eliminate barriers to substance abuse treatment. Okay, so you might think, okay, the activities that we're going to be providing are going to be treatment to individuals, individual outpatient treatment, residential treatment, 12-step support group kinds of things. But in fact, this particular project was to provide those things that are more proximal and are barriers to people getting to treatment. And that was things like transportation. Did they have a place to live? Did they have childcare? So in that sense, those kinds of things actually were activities rather than inputs. So I kind of put those on there because I wanted you to, for some of you, you may be involved in programs that you may not really be sure where to place some of these things. So just keep that in mind, that some of the supportive activities that we provide may feel a little more like inputs. If you could back up really quickly. Thank you. The other thing to think about are outcomes. So what are the effects that on our participants that we expect to see before and after participation? Okay, and this is usually kind of the primary thing that we think about when we're selecting a program. Are we expecting that they're going to be abstaining from some negative health behavior? Do we want to see changes in perception of harm, for example? Do we want to change family communication? What are those things? Why did we select the program in the first place? Because we wanted to see these outcomes. So really being specific about those outcomes is very important in terms of evaluation. Okay, next one. Thank you. So the next thing to think about are outcome targets. So we want to set some reasonable targets for ourselves and kind of set the bar so that we can then have a place to compare. So for example, the number of or percentage of participants expected to achieve the outcome that we discussed in the previous slide. So as an example, it could be 30 participants or 15% of the total participants will report less family conflict upon completion of the program. So that might be one of our outcome targets. Now what's then the distinction between outcome target and an outcome indicator? An indicator are things that are seen and heard that determine whether we are meeting the outcome target. So this is how do we measure whether we've met our target. How will we know if we've met our target? So it may be just improvement of scores on the survey, and that's a really common one, or data collection method that we use, and we'll talk about other data collection methods as well. Next slide, please. So here's a really important thing that I think it's really helpful for people to think about. When you provide a program, it's really important to reflect on your mission and how it relates to outcomes. If you're providing a parenting program, how does that help youth avoid substance abuse? So family conflict is a predictor of youth substance abuse. So if you decrease conflict within the family, this decreases the likelihood that youth will engage in this type of risky behavior. So understanding how your services fit into the bigger picture will help you understand what information and data are important to pay attention to in the course of your evaluation. It's also going to help you immensely when you put together an a logic model. Because oftentimes we see a lot of misalignment or logic models that aren't terribly logical. So we'll get to that as well. It's really important to select the right outcomes to evaluate, and it's really important to keep it simple. Only choose the top couple of priorities. Your services might influence, for example, in the kind of substance abuse treatment space, it might impact employment, family reunification, sobriety, stress levels. But the more outcomes you evaluate, the more difficult the endeavor. It increases the amount of data you collect, makes things much more complex. So what you need to do is determine the most important outcomes to your stakeholders and start there. And then you can always add to the type of information that you're collecting and the outcomes. It also is more respectful of your participants' time and the things that they need to collect, or the information they need to provide back to you. So my best advice would be to keep it as simple as possible. Okay. So, if you really need to specify the outcome indicators that let your organization know the outcomes are being met. So again, if we go back to one of the earlier slides when we were talking about the benefits of evaluation, one of those is we need to justify why we're doing what we're doing and maintain support. So we need to set those those outcome indicators so we can give some indication of whether or not we're doing well. You can say, hey, we decreased substance abuse by 1%. Well, that is great, that's super, but it's hard to know if that's a good amount. And I think when we set indicators and say, when we set objectives, it helps us kind of make sense of that and say, well, is 1% enough? And making sure that we have indicators that speak to what exactly we're doing is really important as well. So we need to make sure that our outcomes are measurable. So here's an example. So if we provide a program to families and say that family conflict decreased, that's not very specific. There are many types of conflict that occur within families, and being very specific about the type of conflict that we're aiming for really helps us better gauge whether we were successful in those efforts. So if we say we had fewer family arguments, that gives you a more specific indicator as to whether or not we were successful. And this also includes our target population. So you might expect different outcomes among different target populations. So for example, and here's another treatment example, women may traditionally fare better than men in treatment. So you might set higher targets for women than men. And you may have different examples for the work that you do. Next slide, please. So you need to identify information needed to show indicators and targets. So for example, how many people went through the program? During what time period? Here's another substance abuse example. How many abstained from drug use for 30 days? Identifying the information that you need up front ensures that you're going to have the evaluation data that you need at the end of the program. And I cannot stress that more. In the work that we do, we too many times see people bring in an evaluator toward the end, and they have not collected the information that we needed all along. So having all of this kind of determined at the beginning really helps you. And this information really relates back to the process evaluation that we talked about. So you document how the program was implemented so that you can make adjustments to your procedures to better ensure positive outcomes. So if we wait until the end to determine what we need to collect, we've also lost out on that opportunity for continuous quality improvement. So we need to know what was provided and to whom and on how many occasions. So another really important step that is oftentimes overlooked, I think they think, oh, we'll figure this out as we go. But it's really important to decide how the information will be gathered. Who's going to collect it? How often? How will it be stored? How will it be reported? How will this information be collected? Let's say you do a survey, and you have someone with your unlimited amounts of program dollars. We could just operate in that space for the moment. You have someone who's going to enter those data for you. How does that information make it from the program site to this person who's doing data entry? That seems like a really small detail that can become a really big issue. For example, in a project that we're doing right now, we're providing envelopes and money for postage for those surveys to make it back to us, because that's an additional burden on their budget to send those things back. So you have to think about those small details because they can be very big issues later on when you're looking for those data. Next slide, please. So there are a variety of ways that we can collect data. So, excuse me, I'm struggling from a cold a little bit, so I apologize for all the throat clearing. So I think the data collection method that we tend to kind of go to a lot is a questionnaire or survey or some sort of checklist, which is wonderful because it provides a lot of information very quickly and easily. It also allows us to collect information in kind of a non-threatening way. It's not like you're, asking someone face-to-face and they're having to say something directly to your face, because sometimes we're asking about uncomfortable behaviors or uncomfortable information. In my work, we ask students, underage individuals, about their tobacco and alcohol use and also illicit drug use. And so that can be very uncomfortable information to ask about. Some advantages of that: it can be done completely anonymously. It can be very inexpensive to administer, especially now with things like SurveyMonkey or those kinds of online survey services. It's pretty easy to compare and analyze. You can assign a number to a response and make comparisons in that way. You could administer to many people at one time and get a lot of data. And there are tons of sample questionnaires that already exist, which makes it very easy to assemble a quick survey. Some of the challenges, though: you may not get very careful feedback. We hear a lot that students say, oh, I just went through and marked, this, that, and the other, and I wasn't really being very truthful or being very thoughtful in my responses. And that's certainly a challenge. There's some ways around that, but it's certainly something that we see a lot. Some of the wording can kind of bias clients' responses. Clients may not, or students may not understand what you're asking them, and so you think you're getting a response, and interpreting those responses can be difficult because they may not have initially understood the question. It can be kind of impersonal. It doesn't allow you to ask follow-up information based on their responses. And depending on how you're doing the survey, you may need some outside consultant to kind of help you with sampling and things like that. Another option is to do interviews, and this really helps you provide more insight on people's impressions or experiences with the program. You get a kind of a fuller range and depth of information. You can develop some rapport with a client or a student. And you can be kind of flexible in what you ask. You can ask more probing questions based on their responses, which you can't do with a survey. It can be very time-consuming, however. It can be very hard to kind of analyze and compare information. It can be very, very costly. We've done some phone interviews in the past, and it can get into the tens of thousands of dollars very, very quickly. And the interviewer can kind of bias clients' responses, especially when you're asking about sensitive topics. And it is a more personal kind of data collection technique. It can create some bias in that they may want to please you, or they may not want to seem like a bad parent or a bad person, so it may change how they respond to you. Another option is a documentation review. So this kind of helps you get an impression of how the program operated without interrupting it. You could review things like applications, finances, memos, minutes, maybe observation forms, or things like that that are collected as part of the program. It can help you get some comprehensive and historical information without interrupting the program. It's information that already exists, so you don't have to worry about collecting new information. And since it's already collected, there's less opportunity for bias. It can be very, very time-consuming, however. The information may not all be there, and you don't have an opportunity to probe for additional information. You may need to know what you're looking for ahead of time, so that might be an issue as well. It's not very flexible way. You might just be left with whatever was collected. And yes, so let me throw out an example here. Let's say we were to implement a strategy to decrease youth smoking. Okay, so we could engage coordinated school health partners to collect different types of data like these presented here. So, you know, I think that when we, the first thing we think of is a survey in a lot of cases. So of course we could ask students about their smoking behaviors, but you know, we could also interview coaches and determine the number of athletes that use tobacco. And that could be, you know, the coach has found out this information either through just simply interacting with the student, but also, you know, through physicals, disciplinary issues, things like that. So we can get additional perspective from interviews with coaches, for example. Documentation reviews could involve reviewing reviewing counselor notes to determine the number of students that were referred to the counselor for violating the tobacco policy. So there's another piece of information that we can collect to evaluate this program that we're undertaking. Next slide, please. Some other data collection methods involve observation. So we can gather information about how the program operates simply by observing. And this allows us to kind of view ongoing operations of a program. And that might be going and just watching a program play out. However, it can influence the behaviors of the participants, so that's something to keep in mind. A focus group is a way to get a group together and explore a topic from a group, and you can get really quick impressions, and you can get a range of information and can kind of probe further, which is wonderful. One of the problems is sometimes scheduling and getting a good group of 6 to 8 people together at one time and having a really good facilitator to be able to not lead the conversation too much. And also a case study is another way of collecting information, and those are less commonly used for program evaluation, but those are really for somebody who has a really unique experience, and you can get a lot of information from one person. So we'll keep that in mind as well. So in our previous example of a youth tobacco prevention effort, in terms of observations, we could ask school staff to provide observations of the number of students that they see smoking on school grounds or even within the community. Because I would like to say that students should not be smoking on school grounds, but there are still schools that you can, unfortunately. In terms of focus groups, we could conduct a focus group with cafeteria staff to learn about what they hear students talking about when they're standing in line in the cafeteria related to tobacco use. Students oftentimes say a lot of things when they think people aren't listening. So I think the food service staff know a lot about what's going on in students' lives. And also, we could talk to a student. We could do a case study to determine what factors came into his or her decision around smoking. So for example, did the program that we implemented impact their decision? So that just shows you some different ways that we could collect data and the partners that we could engage in this process. So the next slide, please. Okay, so I don't want to see everyone logging off now because we've gone to the logic model, but this really is a very useful tool and a useful process to go through to really lay out what it is that we're doing. So the first thing is to say, what's the focus of our project or our program? And remember, a few slides back, we talked about really making sure that we understand what our mission is and what we expect to see out of this program. Inputs, we talked about those. So what are the things that we need to put together in order to pull off this effort? What activities are we going to provide? So in this case, in this example, provide classes to develop job skills and core competencies for job opportunities. Also develop a pool of potential employers for clients in the program. And this, again, is from our substance abuse and treatment area. What are our outputs? So what are the results of our activities? So in this particular example, we seek to have 50% of clients complete classes designed to enhance their interviewing and job-seeking skills. So great, that's really straightforward, and we can know whether or not we hit that target. And then in terms of outcomes, what changes do we expect to see? So in this example, we expect to see them participate in interviews and obtain full-time employment within 3 months. So it can be very simple if you think about a logic model in terms of, if I do this, then I'll get this. If I contribute this input and then I can carry out these activities, which will lead to these outputs, and I should see these outcomes in a very logical flow and in a very timely flow, right? So you don't see your outcomes coming before your inputs or your activities before your inputs. It all lays out in terms of how these things are offered in time. Good, no one hung up. We actually got one more, so that's super. I didn't lose anybody during that section. Okay, so if we can go to the next slide, please. So at the beginning we talked about what we hope to learn here. So what are the benefits of evaluation? It helps us know if we got to outcomes, or if we got our outcomes. It allows us to improve, ensure continuation of our efforts, and justify continuation of funding and support. Next one, please. We also listed the components of a results-oriented evaluation, those being inputs, outputs, activities, outcomes, outcome targets, and outcome indicators, and we saw those again in the logic model. Next one, please. And then also we developed an outcome target and appropriate outcome indicators, as you can see here. Right, and I think the last slide is just an opportunity for you all to ask some questions while you have me. So I think you can enter them in the chat box, and then if I can't see them, Lee can see them and tell me about them.
Hi there, this is Lee. I was muted, and at the same time trying to pull up the questions. I haven't had access to my control panel, so I didn't know if we had a whole bunch coming through. But there are no questions.
Awesome.
Yeah.
I did such a great job, or have confused people to know it. That's good to know.
Well, hang on. Let's put some time. Oh, here we go. Is the webinar PowerPoint available on the website listed? And I can answer that one. I think a lot of people are wondering about that. So the webinar PowerPoint, Jeanie, are you okay with us sharing this in a PDF in our follow-up email?
Absolutely.
Okay, yeah. So as I mentioned at the top of the hour, we will follow up with an email to you that will include a link to the recording, but we'll also include the slides in a PDF for you. Okay, here's another question. How do you see results-oriented versus utilization-focused evaluation?
Well, that's a super question. And I don't know that I have a good answer for you. I think coming from our perspective, I have a lot more experience with results-oriented and also participatory evaluation, so I'm probably not the best person to make that comparison. Any other questions?
Here's another one. How about what is impact evaluation?
Yes, that's a good question. So when we talk about impact and outcomes, sometimes, you know, one of the things about evaluation that's kind of discouraging at times is that there are a lot of terms that float around. And sometimes there's not a lot of agreement on those terms. So I tend to think of outcomes being more proximal and impact being more distal. So meaning outcomes are things that we expect to see a little sooner than impact. And impact will have more, I hate to use the word impact, but we will see that come to fruition a bit later and among a larger population. One of the things that we do in our work is we are very careful in evaluating what happens at the program level where we are interested in the changes among the participants. But then we're also really concerned about what is happening at a wider level, whether that be, you know, we do a program in a particular classroom or a particular grade level, and then how does that trickle up and down to their peers, their older and younger peers. We do the same thing and think about how it impacts the wider community. And so that's how we tend to talk about the difference between impact and outcome.
Okay. We're getting a bunch of questions in. Everybody waited until the end.
All right.
Okay, so we have how to decide if expected outcomes are achievable. For example, if a parenting workshop is designed to build capacity to work with schools, how to come up with indicators and outcomes.
So the question of, you know, are they achievable? That's something that we really struggle with, and there are a couple of ways that we tend to approach that. One is to look at similar efforts and see what kind of outcomes they've achieved, right? So, for example, a family program, right? So we might be implementing strengthening families or guiding good choices or something where we're focusing on the family. If it's something that doesn't have established outcomes, we might look at something that's very similar and see what might be a reasonable amount of change to see from beginning to end. So that's typically what we do. It can be difficult, though, because it's hard to know what is a reasonable amount. Sometimes, though, you have to go back to your stakeholders and talk to them about what they feel like is a reasonable amount. And that's a perfectly valid way of kind of setting your own goals, is to say to your stakeholders, how much improvement would you be okay with? I mean, that's kind of putting it in a very layperson way, but it's true. You know, they may not be expecting a huge return. So, and that's good to know. Not to say that we would set the bar too low, but it helps you understand what they feel like they could expect.
Okay, great. Okay, we've got another question. What are the main factors that should be considered in determining if forward or reverse logic should be used when constructing your logic model?
Oh my gosh, it's like you're in my head. You know, we've really gone back and forth with that because it feels like, what it seems like to me is that the forward versus the backward make more sense to some people and others. And that would be a situation where I would say whatever makes the most sense to your stakeholders and is going to be the most useful. I tend to do the opposite of what I showed you, so I kind of do it the opposite way, because we start with the planning process. We start by saying, what is our issue? And what are the big sort of long-term consequences that we're seeing that we want to make changes in? For example, drunk driving rates. Okay, so in order to change that, we need to change drinking. And in order to change that, we need to change how families talk about drinking and those expectations. And then in order to do that, we need to implement this, that, or the other program or strategy. So I tend to go backward, but sometimes that's confusing for people, and they're like, wait, what? So I really think whatever you and your stakeholders are comfortable with and makes the most sense to you is the right way to do it.
Okay, great. What is a formative assessment?
A formative assessment is really similar to process evaluation in terms of what is it that I'm doing and doing it along the way so that it can help you make changes along the way. So when we talk about formative versus summative is, we get to the end and we decide, so was it good or bad? Was it worth it, not worth it? Formative is more making measurements and adjustments along the way. So that's, part of process evaluation in terms of what did we do so that we can make changes to that as we go and make sure that we're getting the best outcomes possible.
Okay, great. We have several questions actually. The next one is, so long-term and short-term outcomes are related to impact and outcome evaluation?
And that, okay. Can you repeat that?
Sure. It just says, so long-term and short-term outcomes is related to impact and outcome evaluation?
It's related, and we tend to break out, and this is, what I presented here is a more simplified version, but what we tend to do is we think about, and I'm speaking from like our evaluation team here, what we tend to do is we break our outcomes into short, intermediate, and long term. We want to see what we can affect in the in the very short term, what we expect to see in the longer term, and then the very long term. And in terms of impact, we tend to think of that as what is the impact outside of this circumscribed group that we're working with. So are these changes going to then sort of trickle out and affect a wider group? And that's what we tend to think of as impact.
Okay, great. Do you think that focus group discussion is a proper method for evaluation better than surveys, for example?
Well, this is my bias. I know that there are people who use focus groups quite a bit. I come from an experimental social psychology background, so focus groups were not an acceptable, in my training, they were not very, that's not great information. So I tend to feel that way and would rather have, I would rather see surveys myself, but I see incredible value in providing a lot of different information. So that might be a survey to get initial information and to help you come up with additional questions that you might probe in a focus group. I can see value in that, and this is just Jeanie Alter talking, and my bias tends to be focus groups should be more of a supplemental or a way of, they can be helpful in terms of developing some survey questions, but as a primary data collection method, I tend not to use those.
Great. We have 3 more questions. We'll try to get to them all. Let's see if we can. Can you suggest evaluation tools that are effective in showing behavioral changes in a community-based setting?
You know, I think that would be pretty specific to the behavior that you're talking about. So I encourage you to reach out to me if you want some specific suggestions, if you want to share that with me.
Right, and your email is up on the screen right there.
Yes.
Okay, the next question. Are qualitative methods better than quantitative ones? This is, I think, a follow-up from that focus group question.
Yeah. My bias tends to be more for quantitative. I know qualitative researchers that would, engage me in a lively discussion about that. So my bias tends to be quantitative over qualitative, but that's just me.
Okay. I have one more. How can you make sure your survey questions are good questions?
Yeah, that's an entire semester-long class, but there are some, actually I have a kind of silly document that is really good. It's like the 10 commandments of survey question writing. And some of the things that kind of the common mistakes that we make are, loaded questions by really asking 2 questions within one, or, just various things like that. So there's a lot that goes into the psychometrics of a survey. And that's why using established surveys are really nice, but oftentimes you kind of collect more information than you probably need. So yeah, that's my short answer.
Okay, and actually this individual wants to know if we can share that with her.
Sure, absolutely. Yep, reach out to me and I'll send
We'll
that to
plan
you.
to send it to you.
Perfect.
Okay, so that concludes today's webinar on results-oriented evaluation. Thank you so much, Dr. Jeanie Alter, for your great presentation and answering all of these questions. Thank you to all of the folks who participated today. We had a full audience, and we'll be following up, as I mentioned, with an email with a link to the recording and a copy of the PDF of the presentation, and also some information about that document, the 10 Commandments. And so we'll be in touch at some point this week with all of that great information. Thank you, everyone. Bye-bye.
Thank you.